Genetic evidence indicates the presence of at least 2 separate outbreaks of monkeypox. He Centers for Disease Control and Prevention said Friday that new genetic sequencing data indicate there are at least 2 distinct monkeypox outbreaks underway outside Africa, a surprise finding that one official said suggests international spread is wider and has been occurring for longer than has been previously realized. 3 of 10 viruses the CDC has sequenced from recent U.S. monkeypox cases, 2 from 2021 and 8 from 2022, are different from the viruses that have been sequenced by several countries involved in the large outbreak that is spreading in and from Europe. That outbreak is currently being driven by infections in gay, bisexual, and other men who have sex with men. While the 3 divergent viruses are clearly linked to one another and have a common ancestor, they also differ more from one another than do the other viruses, Inger Damon, director of CDC's Division of High Consequence Pathogens and Pathology, told Stat in an interview. The people infected in these 3 cases contracted the virus over a surprising geographic range of places, one in Nigeria, one elsewhere in West Africa, and the third in either the Middle East or East Africa. This apparent wide dissemination of a related virus, one that differs from the European outbreak strain, suggests monkeypox outbreaks outside of the countries where the virus is considered endemic may have been smoldering for longer than has been appreciated, Damon acknowledged. I think that is one very plausible explanation, she said. What we think that this indicates is that there are likely multiple introductions out of Nigeria at points in the recent past, and there are likely additional transmission events occurring globally, Damon said. It does raise the question, are there reservoirs and human infections occurring in a wider area? And I think it's really a further understanding of the Middle East and East Africa as potential areas where the virus was introduced. Damon said it is unlikely that the 3 divergent sequences indicate that there was undetected domestic transmission in the U.S. after the Texas case last July. We don't have any evidence to support that at this point in time. The illness onset of these individuals was really associated with their travel event. When asked if she thought the spread of monkeypox could be stopped, Damon sidestepped the question. Everybody is working really hard to try to understand what's happening and to think about what public health tools can be used to prevent additional spread, including sort of looking at the use of vaccines and the use of therapeutics, which are not unlimited in supply, she said. I think it is only with the tight surveillance and looking at what is happening will we understand whether this is something that can be contained.